All right, today I'd like to welcome Ginger Hoffman, Professor of Anthropology at DePaul University, and Julia Lippert, Assistant Professor of Health Sciences at DePaul University. They're going to share with us on course-based research projects, a project examining the lives and plights of restaurant workers during the COVID-19 pandemic.
All right. Hello, everyone.
Hello, everyone, and thank you for the introduction, Evan.
Yeah, so this is what we'll talk about today. We're going to try and focus on the course-based aspects of it, but then also share a little bit about our findings. And yeah, feel free to put in the chat your questions and welcome. So before we get into the study that we did, I wanted to set the context for restaurant work in general. So if we were all together, I'd have you raise your hand if you worked at a restaurant before. And, you know, you can feel free to do that regardless, but I'm guessing at least half of us, sometimes even more, have worked in a restaurant. A lot of us have, whether it's working at McDonald's in high school or putting yourself through grad school, bartending. Speaking from personal experiences, we've done it. So the restaurant industry is massive. It's one of the biggest industries in our nation. However, it has some really particular structures about it that make it uniquely difficult for workers to be healthy and happy. That's our main goal, right? One is the tipped wage. So the tipped wage is a sub-minimum wage. So it's below the minimum wage. And it hasn't been raised since the 90s. So it's definitely not in keeping with inflation. This suppresses wages. So a lot of, there's a disproportionately high level of low income workers within the restaurant industry. But then the fact that the tip wage puts workers' wages to the discretion of the customers, that creates a significant wage gap. So minorities, women, different groups within the restaurant industry get paid a lot less. And that's dependent on not only tips, but then the shifts you get, where you're working in the restaurant, all those things. There's also a lack of benefits. So workers, by and large, do not get employer-sponsored health insurance, but they also don't get paid time off. So that's vacation time and sick days, which is really important when we're facing a global pandemic, right? And then there's a variable schedule. So your schedule can vary from day to day, from week to week. It can vary, even when you go in, you might think you're gonna work 8 hours and then you get cut early. That leads to variable pay where your pay can be substantially different from week to week, which all of that makes it hard to plan, especially if you're supporting other people.
Yes, and added to that, so with the existing power imbalances, the industry has disproportionately people of color and women working in it. Also, the restaurant industry has a lot of undocumented workers. So we went in looking at this population of workers, already knowing that there were a lot of like power imbalances and a lot of things amok with the actual industry, the rules and regulations. For example, health precautions already were on a low scale prior to the pandemic. So the pandemic in our findings worsened that. It worsened mental health. For example, people would get either laid off or they would have customers who would not pay them the same tips because maybe they were the jobs that they were doing, they were restructured from being a server in the front of the house. They may have been, you know, somebody who is packing up the to-go food and the tip was not the same. There would be elevated exposures to COVID infection. That was particularly the case in 2020. in the first part of the year, as many customers would refuse to wear a mask or would refuse to social distance. And so our participants reported that they really received not only abusive treatment from customers and less tip, but what happened, they also, at the end of the day, feared for getting infected or bringing that infection home. The other thing is the financial instability, which comes from the tipped wage system, which Julia mentioned. Tipped wage has a long history and an ugly one going back to slavery, actually, when people were not paid, African Americans and other people of color, but they were tipped. And so there's inherent job insecurity, financial insecurity, specifically in this industry that, again, the pandemic exacerbated. A lack of clear safety precautions, like I said before, existed prior to the pandemic. Lots of, accidents occurring in the kitchen, accidents occurring in the front of the house, it being unreported, underreported, or people working without benefits and without safety in place to protect themselves. As the pandemic was gaining ground, the safety precautions, the health precautions caught up much later of what needed to be done. Back to you, Julia.
Okay, so this is the study overview that we came together to look at what factors affected occupational stress in general in the restaurant, and then what persisted throughout the pandemic, what still became an issue.
And one of the things that we did, we collaborated with Restaurant Opportunity Center United, ROC. I personally was introduced to them through our colleague and friend at the Stain Center for Community-Based Service Learning, Howard Rosing. And so with any kind of collaboration with a community partner, we always work with the partner to make it truly collaborative and invite them into the study and ask them what it is that what kind of research needs do they have, and how could we make a project together that would be beneficial. So we had two phases in our project. Phase one that Julia will tell you about, and I'll tell you about phase two.
So phase one, I started this work prior to the pandemic, and we were collecting quantitative data, biomarkers for stress. So we would take cortisol levels in the saliva during a typical work shift to see what types of stress people were under. And then we also collected qualitative data through questionnaire on things that might affect their occupational stress. So things like discrimination, questions about general job satisfaction and what contributed to it or brought away from it. And then also questions on effort and reward. So that study was underway. We started in January of 2020. It was halted when the restaurant shut down, but we collected probably about a third of our participants. So we had a little bit of data to work with.
And so in my phase two of the study, what happened, I designed these course-based action research courses. So they involve our seniors, anthropology majors and seniors, who are engaging in data collection. They've had a number of different courses behind their belt in terms of anthropological analysis, research methods, research ethics, and so on. So by designing this course, I talked with ROC to see what their research needs were. And they said they wanted to hear from the workers themselves what their experiences during the pandemic were. So then my task for the students was for them to design interview questions that we're going to ask the participants, which were approved by ROC. And then they went and interviewed the participants. We did everything on Zoom. Again, this was in 2020, so pandemic already raging. And all the interviews were transcribed, recorded and transcribed. I should also mention that both phase 1 and phase 2 were IRB approved, and so on. And so back to you, Julia.
So then we, because we had these two parallel data sets, sort of parallel, mine was collected before Ginger's, but we had these two data sets examining similar things. We decided to analyze them jointly. So to find what types of themes kept coming up prior to the pandemic and then after. And our hypothesis was that some of the things that contributed to occupational stress or occupational health prior to the pandemic would be more so contributing during the pandemic. And we explored things associated with occupational stress. There was more to both of our studies, but this paper, we focused on those data. And here is an overview of our results. There was 4 major themes that we found. So the increased financial hardships, we saw prior to the pandemic, as I mentioned, sort of the way financial hardships or financial instability impacted was different. So it depended on where you worked in the restaurant and the intersectionality of your identity. So in the interviews during the pandemic, some people welcomed the pandemic. It was a time for them to reset, to not be on their feet all the time, stuff like that. While the vast majority of the participants that were, women, minorities, they were experiencing great financial stressors related to losing their jobs. And then there was also the element of the tipped wage. So all of those things were exacerbated. So the wages were even more suppressed because the customer discretion was complicated by this relationship that now required the people that were working there to police the way people were abiding by the safety protocols. They also had much more variable hours. So depending on your status within the restaurant, quote unquote status within the restaurant, your connection with your supervisors, how well liked you were, you got more hours, you got brought back on more early or earlier during the phases. So that was definitely impacting people differentially. And then of course you had this mass unemployment. So you had a lot of people that were considering leaving the restaurant industry. And, these jobs aren't like they used to be, where it's sort of like thought of as a teenage job or a job for summers in between college. These are careers for a lot of people. So, people can't move to new jobs the way that people might perceive them to be able to. And then there was these elevated occupational health risks. A lot of the workers in the interviews said that they would go to work despite the greater risk for COVID. And that would even be the greater risk to themselves, but then also the people in their households that they were caring for. So this was also something we've known about and we've seen in the restaurant industry. A lot of workers go to work sick because you can't get paid. You can't get tips if you don't go to work and you don't have paid time off. So you could lose your job for being sick. So a lot of workers expressed that concern. And then as Ginger mentioned a little bit, the safety protocols were not enforced in any clear way. So there was no federal safety protocols for protecting workers from COVID. There was some guidance offered, but the restaurant owners oftentimes would put the enforcement on the workers. And then some restaurants would be very protective and considerate of the workers, and some wouldn't. So the safety protocols were not handled well, leading to elevated occupational risks.
Right. And to go along with that, some customers, of course, obliged with the safety protocols, but many did not. We heard again and again from our interviewees the sort of abusive maltreatment that they received from customers, and sometimes from sort of passive managers who would not interfere. I think this word, effort exceed rewards, really kind of summed it up. Those people that maintained their jobs were working harder. They were having different positions or having to multitask. Those people who were furloughed, who were let go, found themselves in another different kind of situation. But the restaurant workers that remained found themselves now all of a sudden doing several different jobs in addition to their regular job. And with that, came just more stress and fewer rewards. There was no compensation that would make up for the increase of the workload and the hours. This, as you can imagine, led to all kinds of frustrations, mental health issues. We heard of people more drinking during when off work, feeling more depressed, eating more, and things like this. Just stress upon stress. We've already mentioned the harassment due to the tip wage system, which was a major finding. Again, the tipped wage existed prior to the pandemic, but added to that the element of harassment and workers having to negotiate their safety in all these various scenarios. In order to perhaps not lose their job or get no tip at all, get not paid for their services at all. And then we also mentioned that the enforcement of these safety protocols, particularly in 2020, was really unclear in the first 3 quarters of the year. And added to with the very negative dynamics of customers and managers, this created a very precarious situation for workers.
Yeah, so this all brings us to the conclusions and our recommendations. This was one of the first studies that reported on occupational stress during the pandemic. So a lot of studies have been coming out since, but we felt it was important to get those data out now so that we could hopefully inform some of these reopening plans. And our findings highlight those structural factors that have always contributed most to ill health within the restaurant were just exacerbated. They persisted throughout the pandemic. And so that leads us to our recommendations.
Yes, and there are several which line up with our findings, of course. But for starters, sort of a decrease in the imbalance between employees and customers. And these are, policy type of recommendations of how actually both parties can be protected, but workers for sure. And then to ensure, again, this is a policy recommendation, ensure a fair and equitable work environment. And then the $64,000 proposal, right? The dismantling of the tipped wage system, which I will say that in Chicago and across the nation, there have been several private restaurant businesses who have, dismantled that. But the point is that that's something for restaurants to choose. It's not, a state-led or let alone a federal policy. So there are way too many places where people work and are not adequately paid. And then, of course, to increase benefits and the safety precautions. Once again, these should be policy mandates. Yeah, so thank you very much for listening. Any questions that you might have?
Yeah, now while you're formulating your questions, one thing I wanted to add is we're seeing now as we're coming back on and they're having trouble filling these restaurant worker jobs, the recommendations we made are sort of fixing to some little bit of a degree, at least moving in the right direction. So you see these wages increasing. You see even restaurants are offering benefits now. So this is a really unique time and good opportunity to make these changes that have been needed for many, many years. Yeah.
Yes.
Thank you so much. Yeah, just a reminder, just add a question to the chat and then we can have them answered. I had a question, just while people are typing any of theirs. I imagine based on the phase 1 starting in January and then a phase 2, that this research project to a certain extent formed as it went because of circumstances. You know, you didn't know what it was going to be in January exactly. Were there takeaways for future research that you want to do in that sort of that need to work with the data you have, work with the new situation you have, and then figure out what to do with your research? Anything that you learned from this very acute situation that you had to deal with?
I mean, I would say use qualitative data. I think qualitative data, at least in my field, occupational health, gets a short shift, or it's not as respected, but you can collect data relatively quickly, and it gives you such a depth of information that you really can't get in quantitative data. And then you can oftentimes get that information out quicker, so it's relevant. Yeah.
Yeah, and I would say also, you know, I always tell my students that I work exclusively qualitatively, you know, and I always tell my students to remain flexible, to remain open. Things may change. Well, things really, really changed this time around, you know, from the way that we conducted research on Zoom to everything, the way that we formed a class and analyzed. So that question, I see it in the chat, the students, we worked with ROC. So our community partner helped secure interviewees for that portion of our project. So in terms of that, it was very, very smooth because, you know, I mean, there was a lot of behind the scenes work and so on, but for the students' perspective, wow, they just, you know, had a list of people, they communicated with them on email, by phone, and then they set up the interview, which was mostly by Zoom or sometimes by phone as well, and like that. So that is how that went down.
And my Zoom seems to have frozen up because I don't see a question on chat. Would you mind fielding questions as I try to fix that, if there are any others in chat?
There's another question here. Any data to shed light on the impact or lack thereof of federal and state relief programs? Well, I'll answer, and then I'll let Julia. The little that there is, you know, first of all, it's for documented workers. Like, that's number one, right? And so you know, a lot of undocumented folks work in the restaurant industry. So this is another added problem. So they really, really suffered in these times. But ROC themselves had, like, you know, all kinds of fundraisers going to help distressed families and to help distressed workers, giving us an indication that actually there is very, very little to support. Of course, we know that during the beginning of the pandemic, we did get some relief, right? Some of us who were making less than a particular amount of money. But once again, specifically, you know, restaurant worker focused relief is non-existent. Julia?
Yeah, I mean, so I collected a different data set, but with restaurant workers, and you know, if not 100%, 90% of them all collected that enhanced unemployment. And they were all really scared of it going away. So, you know, it kept people out of bankruptcy, it kept people in their homes. So that federal aid that increased unemployment was really great. But, the restaurants could apply for the PPP loans, and they could pass those on to their workers. Some restaurants would, some restaurants wouldn't. So, kind of the same problem with a lot of these issues is that each restaurant operates individually. So you can't unionize, you can't really call out worker health issues across the board, because, if it's happening at Red Lobster, it might not happen at the fine dining place downtown. So it's really hard. And that's why ROC is such an important group. And, both of us are really glad to be working with them, because they advocate for these issues. So they're not a union, they're just a worker group, worker center, who allows all these things to kind of come together. And they actually brought me and Ginger together. They introduced us. So.
Yeah. Crazy thing is that we've never even met face to face. It's just crazy. Yeah. The same with, the bulk of my students. So it is. So it goes. Anything else? Oh, one more message. Let's see here. Oh, thank you. Yeah, you're welcome. Well, thank you. Thank you all for coming and listening. Yeah.
Thank you so much. And I really appreciate your presentation. Yeah, and thank you for fielding the questions too, since I had a hiccup on my end here. All right.
No problem. Thank you for the opportunity.
Yeah, thank you all.
Thank you. Have a good weekend. Bye-bye.